So now, to put everything that we have just said into perspective, we're very fortunate to have not one, but two individuals, a little bit of change in schedule, two individuals to share their experience of what they both experienced in terms of cardiovascular toxicity. So I'm going to introduce our first speaker. Our first speaker is Dr. Alexa Gaffney, who is, sorry, it's Kiran. Kiran's first, right? Behind me? Yeah, sorry. Dr. Kiran Dhillon has received her PhD in genetics from the University of Washington, where she studied in vivo functions of the Werner syndrome protein. And then she completed her postdoctoral training at Fred Hutch, where she studied genetics and genomics of chemotherapy resistance and BRCA-associated breast and ovarian cancer. But while a postdoc at Fred Hutch, she was diagnosed with triple-positive breast cancer, and she's now the executive director for cancer vaccine at the Cancer Vaccine Institute at the University of Washington, and committed to helping accelerate the development of treatment and prevention vaccines for breast, ovarian, and other solid tumors. And she's going to share her experience with us today. So thank you so much for coming and for sharing your experience. Thank you.
Thank you so much to the organizers for giving me the opportunity to share my story. It's unusual to share such a personal thing with colleagues and the rest of you, but I'm really happy to do it if it's helpful. So the title of the talk is Cardiac Problem Secondary to Treatment, specifically to trastuzumab. And I'll start with, you'll see some photos of myself through the journey that I went through. And this is me in early 2015. I was 37 years old, and I was a postdoc at the time at Fred Hutch Cancer Research Center working on BRCA-associated breast and ovarian cancers, as you heard. And the Seahawks had lost a game in the Super Bowl. I was kind of bummed. I went home, and that same evening, I felt a lump in my right breast. And, you know, given what I did, I knew it wasn't something that I could ignore. Following imaging, turns out it was 1.9 centimeters and invasive ductal carcinoma. I had an MRI that revealed that there was also potentially some node involvement, and that turned out to be just an activated node. So ultimately, I was diagnosed with triple positive, grade 2, stage 1 breast cancer. And I had no family history of breast cancer, and genetic testing did not reveal any mutations in an extensive DNA repair panel. So I'll share my treatment plan. Given the size of the lump and the data out there, I chose to go ahead with a lumpectomy, and that surgery went well and had clear margins, and there's no evidence of cancer in the sentinel node. And the treatment plan that my team came up with was to a combination of trastuzumab and paclitaxel. So I will mention when I had the HER2 positive diagnosis through the immunohistochemistry was kind of iffy, and they ended up confirming it with FISH. So I don't know exactly, you know, what the initial the histology looked like, but it was confirmed by FISH as well. So weekly infusions of trastuzumab and paclitaxel for 12 weeks, and following up with trastuzumab every 3 weeks for the following 9 months. And after finishing the initial 12 weeks and a month off, I had about 6 weeks of radiation to the right breast, and I started tamoxifen in the fall of 2015. So I wanted to share how I tolerated therapy. I actually felt pretty good for most of, I think, that entire experience. The last few weeks of the trastuzumab paclitaxel, I was really tired. I really just didn't feel good. I tried to walk for 20-30 minutes a day throughout everything, but it became pretty difficult during that time. I didn't experience nausea or any other symptoms besides hair loss and the fatigue. But about, I think, almost to the completion of the trastuzumab, the full year of it, I started to notice that my ankles were swelling a bit more, and I don't know if that was due to the just going through everything or if it was related to cardiotoxicity from trastuzumab. I was aware it was a possibility, and I had also been told that generally it's reversible for patients who receive trastuzumab. But I became, really tired during that time, and I think some of it may have been due to sleep apnea that was diagnosed at that time. So that's just sort of another complication. And I would, I was working in the lab the whole time. I didn't take any time off, and I would go take a nap in my car when I would get tired in between experiments. So the cardiotoxicity. So it was interesting to hear about different methods of measuring. Mostly, I had MUGA scans done. At baseline, I believe it was the left ventricular ejection fraction was 55%. But at the week of my last trastuzumab, it dropped to 32 to 33%. And I think the previous one prior to that had been 50 to 51%. So that was pretty scary, not going to lie, at 37 years old to experience that. And though at the same time I was told that, it is reversible and, you just sort of hope for the best. So the last trastuzumab infusion was canceled. I was placed on carvedilol, and I consulted with a cardiologist who determined I wasn't in heart failure, so that was good. And I really didn't, besides some of the ankle swelling I had already been experiencing, I didn't really experience any other symptoms that could be related to that, except for the extreme anxiety of being worried about having heart failure at that time. And then a couple of months later, I had an echo done, which showed that the ejection fraction had corrected to 60 to 61%, which was great. I was very happy to hear that. So since then, this is almost 8 years. In March, it will be 8 with no evidence of disease. Haven't had any cardiac issues that I've known of that time. I continue on tamoxifen and will complete that for 10 years unless told otherwise. I'm still on carvedilol. I'm not sure for how long. That's still to be determined, so we'll see. And as mentioned, I've really leaned into my experiences both as a scientist and as a patient to really help advocate for people who do have cancer, and also as a scientist, I'm able to understand the information, a lot of what's been shared here, and I realize how scary this could be for folks who don't have the background to be able to understand a lot of this medical information. So, and now I work at the Cancer Vaccine Institute, where I'm trying to help other people with HER2 and other types of breast cancer as well. So I'll stop there. Thank you for your attention, and happy to take questions later.